Welcome back, dear viewers, and we're joined by our second guest, where he's going to be talking about joint health, and it is something that concerns many people, from young adults to seniors, with our busy lifestyles, long working hours, and sometimes unhealthy habits. Joint pain and rheumatic conditions have become increasingly common. Today, we are delighted to welcome Dr. Khaled Aldoub, the Vice President of the Kuwait Rheumatology Association, a senior specialist in rheumatology and joint diseases, to shed light on this important topic. He will share with us, dear viewers, valuable tips on prevention, treatment, and the role of awareness campaigns, especially as the world prepares to mark World Arthritis Day on October 12th. So good morning, Doctor. It's such a pleasure to have you here on Good Morning.
Good morning. Thank you for inviting me to your show again.
It's a pleasure to have you always here, Doctor, to explain for our dear viewers everything about arthritis and rheumatology and the prevention of it. So would you please explain something about rheumatology in simplicity so people can understand it?
Of course. So when you hear the word rheumatology, you always associate it with joints, with muscles, with bone. So rheumatology is the field where we study conditions that affect the muscles, the joints, the bones. So it's important to tackle these diseases, because if you diagnose them early, if you treat them early, you will certainly prevent long-term damage and disability. And of course, maintain a whole normal, healthy quality of life.
Yes, definitely. Dear viewers, we brought you Dr. Khaled here to prevent all kinds of pains that are happening.
Hopefully.
And you know, Doctor, some people want to know, how can they know, is it rheumatology or something else?
Of course. So the key is, there are key signs that you have to pay attention for them, which are joint pains that are persistent or recurrent.
Right.
So any joint, let's say the small joints of the hands, the fingers, the toes, large joints such as the knee, the shoulder. So if they are recurrent or persistent, definitely you need to seek a healthcare specialist about these things. But not just joint pains, but also joint swelling, joint stiffness, reduced range of motion or use. So these are the key signs for joint conditions. And if they are persistent, there might be an underlying condition that has to be diagnosed and treated, of course.
All right. And Dr. Khaled, you know, sometimes now in the gym, I see a lot of people going up on the Stairmaster and just doing hours and hours of cardio.
Yes.
Is it, and it really affects the knee pain later. How do you see this, or what do you recommend for people doing that?
So the exercise is a two-edged sword. It can help you, but if you overuse it or use it the wrong way, it might damage you. So exercise is definitely an important way to prevent joint damage, because it strengthens the muscles and makes the joint stable.
Yes.
However, if you overstretch, if you strain the joint and the muscles, of course, you will create more damage. So the problem with the stair exercise is that the stair is too large, and then you will keep climbing for a very long period of time. So my advice is just do it for a couple of minutes and then take a rest. There are other ways to maintain a healthy, normal joint and strong muscles. All right. Particularly the cycling. I like the cycling too much. There are a lot of myths that cycling damages the knee, but that's incorrect. It actually maintains the knee joint, as I said, strengthening the quadriceps muscle, the hamstring muscle, so it will maintain the joint stability. It will make your pain less.
Perfect, perfect. Dear viewers, you heard it from Dr. Khaled. Please stop using the Stairmaster and go to the bike section.
Yes.
And Doctor, I've researched something about watermelon, especially, that it helps the joints warm up before training. Is this true? Like, is there any food that we can take that helps our joints function better?
So I'm not sure about the watermelon, but the idea of the watermelon is that contains a lot of water. And the water is important and essential for the joints and muscle. So maintaining a healthy, balanced diet will definitely reduce inflammation of the joint, reduce damage and tearing of the joints. So fruits, vegetables are important. Watermelon in particular, because it contains a lot of water, as I said. But not just that, maintaining the optimal body weight can reduce the pressure on the weight-bearing joints, such as the knee, the hips. So these advices can maintain the joints for a very long time period if you want to avoid wearing and tearing and damage of the joints over long time periods.
All right. I'm sure, Doctor, as you give examples and advise our viewers, lifestyle plays a big important role in our daily life.
Definitely.
And what daily habits would you recommend for people to strengthen their joints also?
So the three main advices, as I mentioned, one is maintaining the optimal body weight. So always try to calculate your optimal body weight. If you are overweight, just aim for reduction between 5 to 10% of your body weight. You will feel it. You will feel much better. You'll feel healthier. Your joint will be stronger. You will have less joint pain.
And it will thank you.
So
the joint will thank you for that.
Certainly. So that's the first advice. The second advice is exercise. So there's a myth that exercising and using your joints will damage your joints further if you have arthritis, but that's incorrect. So to maintain a healthy joint, you have to exercise, you have to move. I usually encourage actually it's not just me, but that's the latest guidelines from the American College of Rheumatology. You have to exercise. You can do it with aerobic exercise such as cycling, such as jogging, stretching exercise important such as yoga, Pilates, yes. Also swimming, even strengthening exercises or resistance exercises such as weightlifting are helpful for the joint if you don't over exercise or over strain your joints.
Yes, doctor, definitely. And dear viewers, please don't do over exercising as Dr. Khaled advised. Personally, doctor, I like to walk on the sand, you know, the sand beach. And we have, mashallah, the coastlines from all over Kuwait stretches there.
Yes.
Because if you walk on sand, I'm sure it helps your ankles and knees function better. Is this true? Is it better than exercising at the gym?
So it's another way to exercise. There are no study proving that it might be better, but of course people are talking a lot about it. So if it's fine with you, then just go ahead and do it, as long as you're exercising and moving your joints.
All right, yes, dear viewers, if you love exercising, just do whatever you want to do. And if you have something or pain or you notice something, just visit the doctors, and I'm sure Dr. Khaled Aldoub will find you a solution.
It's my absolute pleasure.
Definitely. So there are misconceptions, doctor, about arthritis. What are the most common ones that are being conveyed between people?
Oh, so there are a lot of myths. Let's talk about the important ones. One of them is that arthritis is related to elderly alone, and that's incorrect. Arthritis can happen in all ages. It's just the diseases are different. So as an elderly, you would expect wear and tear, which is osteoarthritis. Yes. But as a young adult, you might get affected with autoimmune arthritis, such as rheumatoid arthritis. Right. And it can even affect children, can even affect adolescents. There are even specialties or special doctors that tackled these problems, which are pediatric rheumatologists and adolescent rheumatologists. So this is one myth. There are many myths. Another myth is that joint pain is related to growing older. That's incorrect, of course. Joint pains means there is something abnormal. It's a sign from your body that you have pain. You have to investigate, you have to tackle it, because if you investigate it early and tackle it early, you will prevent further damage. If you don't, you might progress and you will have deformities and disabilities, and that's our aim, is to tackle it early, diagnose it early, and treat it early.
Yes, definitely. Dear viewers, you should really hear the advice of our doctor, because we really love your health and we want the better for you. And therefore, as you know, doctor, a lot of people now are working behind desks and sitting for long hours, for example, like 2-3 hours just sitting down, working on their emails. And you know, when they get up to stand, there's some joint pain.
And stiffness.
And stiffness. What do you recommend they do while they're sitting these hours?
Yes, so I always hear this question, and my advice is always take a break to exercise your body, even while sitting. So you are sitting for long hours, like 7 or 8 hours. So just make stretching exercise over your foot, your leg, your knee, even your neck, your shoulder. If you can take a walk around, that will be brilliant. And it's not just about exercising and stretching. Your sitting position is essential as well. So make sure you're sitting in the right position, your foot on the floor. Let's say if you're using a computer, make sure the screen is at the level of your eye, not down, yes, so you don't hurt your neck. When you're using the keypad, make sure your hands is straight, not overstretched or flexed. Yes. And this position will hurt your wrist. So be alert about these things, because you're staying for work for very long time, and you're staying there for weeks, months, years, some for 30 years and above that. So you don't want to damage your body while working or while sitting in the desk.
Definitely, definitely, doctor. Thank you for making their viewers aware about them not moving a lot, and they have to. So, doctor, we'd love to hear a last message from you that people are seeking to get medical attention and rheumatology, and what kind of new technologies that are happening.
Oh, I'm glad there are many advances in the field of rheumatology, particularly in the diagnosis, early diagnosis and the imaging and blood test. But the main thing, the giant step, or let's say the giant leap ahead in the field of rheumatology the past few decades was treatment and how effective the treatment had become. So previously, treatment might help the pain, might reduce the symptoms, but eventually the patient have disabilities and deformities, such as rheumatoid arthritis. Right. I'm happy to say now we don't see that anymore because of the advances in the field of treatment by using the biological therapy and targeted synthetic therapy. These medications are really effective, they are fast, and they prevent further damage, so the patient can have a normal, healthy life.
Definitely.
That's our aim.
Definitely, and of course, people like you in medicine help us a lot with all kinds of pains, doctor. Thank you so much for being here on Good Morning Kuwait and making our people aware of how to deal with such kind of things.
I'm happy to share all my advices and information for that.
Inshallah.
And actually, we're having the Kuwait Arthritis Day coming 11th of October. So every year we're celebrating, every October we're celebrating World Arthritis Day. Usually it's October 12th, but in Kuwait we're celebrating this year on Saturday, 11th of October. It will be in the Avenues Mall. We're offering free advices, consultations. There are going to be rheumatologists, other collaboration with other teams such as dermatologists, orthopedic. So anyone who wants to ask questions, advices, education, we can educate about anything. We'll be happy to help. Please join us in the Avenues on the 11th of October.
Yes, thank you so much, Doctor, for being here and also opening up to the public to invite them for your campaigns.
Of course, it's my absolute pleasure.
Yes, so dear viewers, let's all thank and appreciate the coming of our guest, Dr. Khaled Aldoub, the Vice President of the Kuwaiti Rheumatology Association, a Senior Specialist in Rheumatology and Joint Diseases. Thank you so much.
Thank you for having me again.
Yes, dear viewers, therefore we have reached the end of Good Morning's program's episode for today. Also tomorrow, dear viewers, we're going to be hosting you with more special guests to inspire your day and make it a lovely day. And therefore, we wish you a nice day ahead.